The strength of the relationship between payers and providers is dependent upon their ability to communicate and share information. Meet Dr. Gerald. He's the medical director at Sigma Health Insurance Plan, where he's tasked with ensuring that Sigma maintains the right level of care quality to keep its star rating of 4 and above. This rating makes Sigma eligible for bonuses and rebates from the government for its Medicare Advantage plan. Dr. Gerald is definitely overwhelmed. To meet the star ratings metrics, he needs to ensure that Sigma's providers take good care of their patients and close any care gaps they might have. Unfortunately, the care gap information is with Dr. Gerald at Sigma, and he has to rely on antiquated methods to share this information, which does not often reach the doctor's office in time. As a result, his providers miss opportunities to address care gaps during patient exams, which can result in repeat visits to the doctor's office and a lower star rating for Sigma. Meet Anne-Marie. She's Vice President of Revenue Program Management at Sigma Health Plan. Like Dr. Gerald, she focuses on Medicare Advantage contracts, but her goals are based on revenue implications of health and quality. To capture the appropriate revenue based on health and quality from Medicare Advantage contracts, Anne needs to ensure that the doctors treating Sigma's Medicare Advantage patients understand their patients' full risk profiles so they can treat them with the right level of care. By documenting appropriate care, Anne and the providers can demonstrate care quality to the government and receive appropriate risk-adjusted payments. Technically speaking, if Anne can help the doctors use the right hierarchical condition code, or HCC, to portray the patient's risk, Sigma can convert it into an RAF score that will determine the monthly payments from the government. Now meet Dr. Steve. He's a family doctor who loves helping people, especially seniors. But Dr. Steve doesn't have as much time to spend with patients as he used to, because he's stuck in a never-ending whirlpool of paperwork and chart requests. Dr. Steve knows that in order to get paid for his work, Sigma is relying on him to deliver high-quality care and generate high revenue at a low cost. Dr. Steve's life would be a lot simpler if Dr. Gerald shared patient gaps in care information, and Anne provided the right HCC to his staff when he needed it, all while high-risk patients were in his office. Dr. Gerald, Anne, and Dr. Steve stop and wonder why, in this digital age, they're burdened with more and more manual processes, administrative overhead, and paperwork. The good news is, there's a solution. It's GE Healthcare's Superhighway. GE Healthcare is building a solution that enables Dr. Gerald and Anne to communicate electronically with Dr. Steve in near real time. Unlike the current system, where sharing is slow and miscommunication is the norm, GE Healthcare's solution is incredibly fast and simple to use. Through this superhighway, Dr. Steve and his staff can receive information in time for them to take action. Delivered to them at the point of care, there is no new paperwork, so Dr. Steve can now keep Dr. Gerald happy by automatically sending him all the clinical information he needs to comply with government reporting needs. What's more, Dr. Gerald now knows when Dr. Steve closed the gap in his member care and what level of quality care is delivered to Medicare Advantage member. And what about Anne? She is delighted to see an increase in cash flow from higher payments, which enables her to spend more time on strategic initiatives. GE Healthcare's Superhighway is a secure, instant healthcare information exchange for reducing costs, increasing reimbursement, and allowing both health plans and providers to focus on better care for us all.